This is an example of the female urinary system. On the left here we have a kidney, on the right another kidney. The kidney produces urine, and that's passed down through these little tubes called ureters into the bladder, where we store urine. And after storing it for some time, we then pass it out through the urethra. The storage facility of the bladder can be affected by a number of conditions, and I'll discuss some of them shortly. This is a side view of the female urinary system. This is the front and this is the back. The bladder sits here just behind the pubic bone, and then there's a urethra tube through which we pass urine. In this particular diagram, there is a catheter or urinary tube in the bladder. Some women suffer with a condition called stress urinary incontinence. That's when they cough or laugh or sneeze, they may leak some urine. When it's mild, we can control that usually with some conservative measures, including pelvic floor training and muscle exercises. As it becomes more severe, it may need surgical treatment, where a little tape is placed at the neck of the bladder, just below it, to support the urethra. And that works in quite a lot of women to control stress urinary incontinence. The procedure is done usually as a day case procedure and is usually very well tolerated. A woman should be able to return to most of her normal activity within 2 weeks. It's important to realize, though, that all surgery has potential problems. In sling surgery, for example, in a woman who is appropriately selected, 80% of women will feel that they are very happy with the outcome and dry. Perhaps 10% will be drier, but not completely dry, and still relatively happy about having the procedure. But in the remaining 10%, there will be a variety of complications, and they could include frequency and urgency. That's where there's a strong desire to pass water often, and at other times, a combination of infection, bleeding, or inability to pass urine completely, and that's called retention or partial retention. Very rarely, there might be a number of pains that a woman might complain of, most commonly with a certain type of sling, inner thigh pain. However, most of the complications are relatively uncommon.